So the last time I talked about my weight loss and semaglutide, I had mentioned that I'm doing testosterone as well. Testosterone replacement therapy, hormone replacement therapy, whatever you want to call it. Clearly, I'm not a doctor. This is not medical advice. I'm going to stick with what I did for me. Studies and what I did for other people, I'll leave that to the experts. And many of these questions came from men and women in private message. And there's no shame in my game. If it helps somebody, I'll talk about it. Roughly when I was around 40 years old, I started feeling lethargic. Didn't really want to go to the gym. And when I did go, I was sluggish and the recovery was long. Increased belly fat, low libido, depression, all the things. From my understanding, first responders and military have this onset sooner. Most men, it could be 50 or 60. It's because of the stress, night shifts, and we eat like crap. Went to a doctor, got tested, sure enough, low T. At the time, it was a shot every 2 weeks. Then it went to one every 7 days. And now it's a sub-Q shot twice a week. That keeps my levels way more stable. As I recall, it took about a month for it to really kick in, and it was like night and day. You don't realize how bad you feel until you start feeling good again, especially because that decrease in testosterone is so gradual. My first doctor brought me up to minimums, but you don't want minimums, you want optimal, because there's a big range they can play with. Now with mine, I'm in a routine. I like my doctor. If it ain't broke, don't fix it. And insurance covers it. So to be clear, I don't use Regenix for this, but they do offer free screenings, and they have experts to bring you up to an optimum level. That's where you can go, and then they're right at the top. Notice the discount code. Unless you live in the area, they do everything by telehealth. I assume they have labs ordered that are close to you, and then they just mail it in. And I have nothing but good things to say about TRT. And I'm guessing one thing kind of leads into the other thing. My body burns more calories. The nutrient partitioning is better. I feel better because I go to the gym. I go to the gym because I feel better. The gym helps me manage stress better, so my emotional state's better overall. Can I ever come off? Yeah, you can, but you'll go back to where you were. And for me, that's not happening. Now, I did have to come off to have our baby, and once that deed was done, I got back on the next day. Now, some people don't notice as big of a difference as I did, but for me, night and day, game changer. I believe they also work with women for hormones and menopause, but I don't know anything about it. But it never hurts to ask experts, especially if you think any of this applies to you.